This final session is about what happens after your baby has arrived. We'll start with some information about newborn babies and then cover your immediate postnatal care. Our physio will then discuss some perinatal ergonomics, getting your body back into shape. And then our child health nurse will talk about some of those support services and programs that new mothers can access out in the community. Regardless of the position you birth in, it's our aim to get your baby into your arms as quickly as possible and not to interrupt your skin-to-skin contact for at least an hour. Some mothers are surprised at how their babies look immediately after birth. They may be pale or a little bluish, have puffy eyes and a squashed up face. Their head may be cone-shaped, their genitals look enlarged or swollen, and they can develop these transient blotches and marks on their skin, which is also covered in a greasy white substance called vernix. They may not cry for a few seconds. When they're 1 minute old, we give your baby a score out of 10 to record their condition at birth. They get 2 points each for colour, breathing, heart rate, muscle tone and reflexes. We then score them again at 5 minutes of age. These APGAR scores are then written into your baby's personal health record. Now this is what your baby's personal health record looks like. It's very similar to the pregnancy health record that you carried to all your antenatal visits. And this booklet will contain the important information about your baby from birth. The booklet's given to you when you leave the hospital. It allows you to record ongoing details of your child's health, growth, development and vaccination history right up to the age of 5. We do not replace these booklets if you lose them, so keep them in a safe place. In the first 2 hours after birth, while your baby is enjoying skin-to-skin contact and that first breastfeed, we're observing your baby's vital signs every 15 minutes. After that, we take their measurements of weight, length and head circumference. We give them their newborn injections, which is vitamin K going into their left leg, and the hepatitis B vaccine goes into their right leg. This is done, of course, with your informed consent. We then dress them in the clothes that you've provided. Well babies stay with you all the time while you're in hospital. It's important that they have a name tag on both a wrist and an ankle, and that those name tags are replaced immediately if they fall off. Please note that your baby will have your surname while you're in hospital, regardless of what you choose to name your baby in the future. We also give you your important legal documents at this time. You'll be given this envelope called the Parent Pack. It contains a signed newborn child declaration to support your claim for family assistance payments, to enrol your baby with Medicare, and to register your baby for a digital health record number. It also contains instructions on how to officially register your baby online to generate your baby's birth certificate. Now these documents also are never replaced by the hospital, so please keep them in a safe place until you've completed all the instructions. You have 8 weeks to register your baby. Much of what midwives do is teaching you how to care for your baby. Now, bathing your baby occurs as an educational opportunity just before you go home from hospital, or it can be taught by the midwife who visits you at home. We make sure you feel confident to change nappies, how to dress your baby and swaddle them, and how to care for that umbilical cord stump. The goal is to keep that clean and dry with a cotton tip until it falls off within a week or so. To keep your baby safe, we want you to always check your baby's ID tags if they've been separated from you for any reason. Use your baby's cot for sleeping and moving them around the hospital rather than carrying them in your arms. Limit the direct contact they have with other people, especially anyone who may be unwell. And ensure your hands are washed prior to any contact with your baby, especially after changing their nappy. We offer a number of screening tests for your baby. 1 or 2 babies out of every 1,000 will be born with a significant hearing loss. If this loss is not picked up at an early stage, it can affect their speech and language development and future learning at school. So we offer all babies a healthy hearing screening test as soon as possible after 6 hours of age. In Rockhampton, we have a clinician here each day to make that happen before you leave the hospital, or an arrangement can be made for that to be done in your local community if necessary. Many babies develop a yellow discoloration of their skin. It's called jaundice. It can be very normal if it's mild, so your midwife and child health nurse will perform checks on your baby to identify any baby who might need treatment for their jaundice. You can see the baby in this photo has quite extensive jaundice and required phototherapy. In some circumstances, babies are at risk of having low blood sugars. So if your baby carries that risk, blood glucose testing will be done regularly in the first 24 hours. Your baby will need to stay in hospital until those results stay within a normal range. Another test that we do is the neonatal screening test, because there are a number of metabolic conditions that require treatment right from birth. This test involves taking a blood sample from your baby's heel and collecting it on a card to send it off to the state laboratory. If you don't receive any feedback from the test, you know the result was normal. The test needs to be done when the baby is between 48 and 72 hours of age. So that test might be done in the hospital or at home with your midwife. Prior to your baby going home, we will conduct a head-to-toe well baby check and record this information in your baby's personal health record. This check is then repeated by your GP when your baby's between 7 and 10 days old to make sure that no new conditions have emerged. In hospital, we encourage mothers to take responsibility for completing their baby's feed chart, which is kept on the side of your baby's cot. The information you record on this feed chart helps your caregivers evaluate your baby's well-being. You write down every time your baby feeds, the type, quality or quantity of the feed, and also any wheeze and poos. If you've never seen a newborn's poos before, it can be quite a surprise. So this chart shows a typical bowel motion of a newborn, which they start out looking a bit like thick Vegemite, transitioning to greeny brown by day 3. And then when breastfeeding's fully established, a breastfed baby's bowel movements are a mustardy yellow colour. Babies may just have one wet nappy on the first day of life, progressing one more each day until they're about 6 days old, when you would expect 6 to 8 wet nappies and 4 poos or so in 24 hours. When you go home from hospital, the home visiting midwife and the child health nurses will ask you about your baby's bowel and bladder habits, and they can provide advice if you're concerned. Now, this is a reminder about the evidence-based strategies to reduce the risk of sudden infant death syndrome. Always sleep your baby on their back with their feet at the bottom of the cot. Have a firm mattress that fits in the cot well, with no pillow, no toys or loose covers that they could put over their heads. Have your baby sleep in their cot in the same room as you for the first 6 months or so, and avoid their exposure to cigarette smoke, remembering that the cigarette chemicals can linger on your clothing. If you're planning to use a harness or a sling to carry your baby, ensure you choose one that allows baby's hips to be in a supported, flexed position with the legs spread, like the one shown here on the right. This provides more stability to your baby's hips, preventing hip dysplasia. The only way babies can communicate a need is for them to cry. They'll cry when they're hungry, wet, dirty, hot, cold, uncomfortable, frightened, startled, or just lonely. Baby life is a steep learning curve for them, and they'll need lots of reassurance and love. In the first few weeks especially, many parents get distressed if they perceive their baby is too unsettled. Each baby's different, and it can take a while for you to learn what each cry might mean. Although some do, not all healthy, happy babies just feed and sleep. You'll discover that you'll need a number of strategies to settle your baby, and they'll work well sometimes, and sometimes they will not. Remember to take some time out for yourself if you're getting distressed by your baby's cries. A fresh pair of arms can make all the difference. So let's talk about a new mum's postnatal care. You can expect to have some period-like bleeding for the first few days after birth, tapering off over 4 to 6 weeks, so you're definitely going to need a couple of packs of maternity pads. Obviously, no tampons can be used during this time until your placental site and the birth tract have healed. The amount of vaginal loss will increase when you breastfeed or when you're first getting up after lying down. Your loss should always change over time, going from heavy amount to light, fresh red in colour to old brown, then getting paler over time. Your midwife will check that your uterus is firm and contracted, gradually reducing in size as it goes back into its place in the pelvis. If you have stitches, you'll be shown how to put some ice fingers on them to reduce the swelling for the first day, and then they just simply need to be kept clean and dry. You do this by changing your pads frequently and showering after a bowel movement. We aim to get mums and bubs out of the hospital environment and back to your home as quickly as possible. Being in your own home is safer and more comfortable for you. On average, first-time mums stay in hospital for 1 night after the birth if everything's uncomplicated. Some may need some extra time to establish that infant feeding. If you've had a caesarean section, you usually go home on the 3rd day. We will then arrange for the community-based midwives to visit you at home. On about day 3 after the birth and the hormones that had sustained your pregnancy have dropped dramatically, many mothers experience what we call the baby blues. Mothers get teary and emotional and feel quite overwhelmed as they face the reality of being a mum while they're physically recovering from all the changes in their body. Getting enough sleep and rest is a challenge in the first few weeks. If your symptoms of baby blues extend beyond a few weeks, please discuss this at your 6-week postnatal checkup with your GP. Postnatal depression affects approximately 10% of mothers to some degree. Some women will just need some practical support, and others may need medication to help regulate their brain chemistry. Beyond Blue is a recommended website with national helplines and online forums and other resources for postnatal depression. There's even a mental health checklist for mums if you're not sure that your feelings are normal. Please be kind to yourself. Have realistic expectations that you're not going to be able to keep everything as spotless and organised in your home for the first few weeks. Accept those offers from family and friends to help cook meals or do housework so that you can focus on establishing your breastfeeding and sleeping when your baby sleeps. There are multiple avenues of support for new mums and new dads. You do not have to do this alone. Please remember the African proverb that it takes a village to raise a child. One of our child and family health nurses will talk to you next about the services and programs in our community that can be helpful to you.
Hi everyone, my name is Misha and I'm the Women's Health Physiotherapist at the Rockhampton Hospital. Today we're going to talk about physiotherapy in the peripartum period. So today we're talking about some common issues that you might find in pregnancy and the early postpartum period. So we're going to talk about back pain and pelvic girdle pain, rectus diastasis or abdominal separation, the pelvic floor, exercise guidelines, good bowel and bladder habits, early recovery, and when to seek help. So first we're going to talk about lower back pain and pelvic girdle pain. So this can be really common in pregnancy. The symptoms can be varied. So there can be issues with a general lower back ache, sacroiliac joint catching, pubic symphysis pain, or sciatica, which might be sharp or shooting pain into the buttocks or down the leg. The causes for this are multifactorial. It can be due to a change in mechanics, so increased weight at the front of the body as bub grows, changing the mechanics of the spine, increased ligament stretching or sensitivity, generally due to changes in hormones, and nervous system changes due to, again, hormones or stress or lack of sleep. So if you do have pelvic pain or back pain, there are a few different things you can do about that. So first of all, if you can access a physio referral, that's ideal because then the physio can prescribe you specific exercises and advice specific to your circumstances. First of all, a physio referral is recommended, which you can access from your midwife or GP. Other things that you can do for pelvic girdle and back pain is movement and exercise. Evidence shows that if you can stay active and keep moving during your pregnancy, that you actually experience less pain and cope with that pain better. Other things that can be helpful, ice pack and heat pack, simple analgesia as prescribed by your GP or recommended by your medical care team. Supportive devices can be helpful, such as tubey grip, belts, braces, or specific brands of compression shorts. Some tips for sleep is to try and sleep on your side with a pillow between the knees or under the tummy. When you're getting in and out of bed or in and out of your car, try and keep the knees together to reduce shearing force through the pelvis. When you need to get pants and shoes on, try and sit down rather than standing. And breathing out with effort can sometimes reduce the pressure on the lower back. Also, don't forget the basics. So try and optimize your sleep, stress management, and nutrition. For back care during pregnancy and the early postpartum period, there are a few things you can do to help minimize back pain or to reduce the severity of back pain. So first of all, making sure that you're keeping your legs and core muscles really strong. This will go a really long way to helping support your back. The other thing that's important to do is monitor for prolonged postures, so particularly feeding baby. Make sure that you are making yourself really comfortable before you bring bub to you for feeds. For bending and lifting, make sure that we're using our legs as much as possible, and for keeping a neutral spine. So rectus diastasis or abdominal separation is really common. Pretty much everyone in pregnancy will get abdominal separation. The muscles have to separate to allow for bub to grow. Usually the separation resolves itself within 6 weeks, and we're less concerned about the size of the gap and more about the function of the muscles around that gap. So if there's a really large separation, your midwife might give you tubey grip on the wards before you leave to try and help to reduce that gap. If it's an ongoing issue, then sometimes some targeted exercises with physiotherapy can be indicated. The core muscles are a group of muscles that all work together to help stabilize our trunk. So the 4 muscles are the pelvic floor at the bottom, the diaphragm at the top, our deep abdominal muscles, and our deep back muscles. And these muscles all work together to help regulate pressure for day-to-day activity. So the pelvic floor muscles are a group of muscles that are really important for keeping the organs up in their anatomical position and keeping the sphincters to the bladder and bowel closed. So the muscles run from front to back, from the pubic bone to the tailbone, and then between the 2 sit bones. So to activate the pelvic floor, it's a sense of a squeeze, lift, and let go inside. There should be no movement of the abdominals, no movement of the legs, no breath holding. So if you're watching someone exercise their pelvic floor, you shouldn't be able to tell they're doing anything at all. So in order to get the right muscles to work, you might think about the sensation of stopping a wee, stopping wind, visualizing you're trying to pull a tissue out of a tissue box with your vagina, or for the boys, nuts to guts. Or if you're sitting, imagining you're trying to pull your perineum up away from the chair. These exercises are really important because during pregnancy, the muscles get a bit stretched and weakened from that growth of bub, and also during vaginal delivery, they can also get stretched and weakened. So they're really important to exercise both before and after you have your baby. Exercise during and after pregnancy is really important. We'll be talking about some general guidelines. So if you think your individual circumstances are different, then it's important to seek medical advice. Pregnancy is a perfect time for behaviour change. We've cut down alcohol, we've cut down caffeine, and now we want to get more active. So exercise has lots of health benefits for both you and baby. It's also really important to model a healthy lifestyle for your children as they get older, because they're more likely to exercise if they can see their parents exercising. So it's a really important time to get active. The current physical activity guidelines state that everyone should be active for about 30 minutes every day. This is particularly important during pregnancy and the early postpartum period. There are many benefits to exercise. Exercise is good for almost every bodily system. So the respiratory system, our cardiovascular system, our bone health, muscle health, hormone health, weight management. There are lots of reasons to exercise. Exercising post-pregnancy is really important to try and help maintain strong trunk and pelvic floor muscles, improve our posture, improve fatigue, as exercise has been shown to improve sleep quality, and also to help return to pre-pregnancy fitness and a healthy weight range faster. When to start exercising postnatally depends on a few things. So our pre-existing fitness, both before and during pregnancy, are important to consider. Any back or pelvic pain during pregnancy or any pre-existing back problems. The type of delivery is also important to consider, vaginal versus cesarean, as cesarean typically tends to be a little bit slower to recover as it is major abdominal surgery. We want to aim for regular exercise. So as we said, the guidelines currently state 30 minutes on most, if not all days of the week is recommended, accumulating at least 150 minutes a week. We want to make sure we're comfortable wearing loose clothing, we're wearing suitable footwear, we're using a stable level surface to exercise on for safety and balance. We're making sure we're plenty hydrated and not fasted before we exercise. Choosing a cool time of the day to exercise, particularly in Rockhampton, is very important. The most important part of exercising is to make sure that you're building it into your routine. So the best exercise is the kind of exercise that you're going to keep doing long term. So you might start with 5 or 10 minute walks, and all you want to do is gradually build that up to about 30 minutes at 6 weeks postpartum. It's really important when you're getting back to exercise to make sure that you're listening to your body. Don't be tempted to overdo it. So really important that you start really slow, really light, and gradually build up. You might start with exercising only 1 or 2 times a week, but gradually build as you feel comfortable. Just be aware that adequate rest is also really important. So if you've not been sleeping well or not getting enough rest, then sometimes a nap is more important than going on that walk. It's important to minimize or avoid activities that cause any bladder or bowel leakage. Any activities that involve high impact exercises until the core, the abdominal and pelvic floor muscle strength has returned, which typically we would recommend waiting at least 3 months. So impact exercises such as jumping, hopping, skipping, quick or jerky movements or frequent change in direction movements such as in sport, all of these activities would be best left till after the 3-month period. Important to minimize any overloading or overstretching of the muscles or joints, as pregnancy hormones can keep joints more flexible than normal. Important to avoid any water exercise in the pool or in the ocean if there's any ongoing vaginal bleeding or any unhealed perineal or cesarean wounds, just because of the increased risk of infection. And important to avoid activities that cause overheating. Some general postnatal physical activity guidelines for the first 3 weeks include gentle walking, some light stretching, gentle low-level core exercises, and pelvic floor exercises, which you can start as soon as you feel comfortable, gradually increasing the repetitions, the effort, and the holding capacity. Weeks 3 to 8 postnatal, we want to increase that walking pace and distance. We can commence swimming and water-based activity once bleeding has stopped and we've had our 6-week GP check. We can start a gym program at this point as long as we start with low load, light weight, and can maintain good posture. It's also appropriate to start low impact aerobics and its targeted postnatal classes, and we want to keep up the abdominal and pelvic floor exercises during this time. Over weeks 8 to 12, typically we're just progressing on weeks 3 to 8, slowly increasing the intensity and the weights on our exercises and progressing our abdominal and pelvic floor exercises. Over weeks 12 to 16 is when you might consider returning to impact activity. So it's really important to aim for a really strong core and pelvic floor before returning to these activities. Important to listen to your body and slow down or reduce the intensity if we have any symptoms of back or pelvic pain, vaginal heaviness, or any bladder leakage, either during or after exercise. Many women find the pelvic floor first app quite handy to know what exercises to do at what stages, and there's a handy 3 different levels of fitness that you can work through. Full disclosure, this app is not endorsed by Queensland Health and you would be using that at your own risk. Good bladder and bowel habits for pregnancy and postnatal. So for the bladder, you're probably emptying the bladder a lot more than normal currently in your pregnant state. But for most people, emptying the bladder 6 to 8 times a day is normal, aiming for about 250 to 400 mils each time. If there's a big deviation in this for you, that's something to flag with your care team. We typically want to aim to drink 2 to 3 litres a day of mostly water. But if we're breastfeeding or exercising, you might be on the higher end of that. Particularly in our hot climate, 3 litres a day is ideal for breastfeeding for most people. For the bowels, normal is anywhere between 3 times a day to once every 3 days for the bowel to empty. But what's more important than frequency is consistency. So we want the bowel motions to be soft and easy to pass, so there's no straining on the pelvic floor. So making sure we're having plenty of fruit, fibre and water for that. And postnatally, if we've had a vaginal delivery, often it's more comfortable to support the perineum with a clean maternity pad for emptying the bowel, and also using a footstool and leaning forward to unkink the bowel. Some tips for early postnatal recovery. We're going to talk about the RICE principle. So R is rest. So making sure that we're having plenty of lying down rest, because that is the only time that your pelvic floor and perineum really get to have gravity-free recovery time. If bub's happy to be fed and lying down, then that's a bonus, because then you get to have that time as rest for your pelvic floor as well. I for ice. So ice can be quite helpful in those first few days or weeks for helping to reduce any pain or swelling around the perineum, particularly if you've had any stitches. C for compression. So there are lots of products on the market for compression support around the perineum. We can also use double underwear or double pads to help apply compression to help with that early swelling and to help with that recovery. And then E for exercise. So we want to get started on our pelvic floor exercises as soon as that's comfortable. So getting started with some pelvic floor exercises early can help with circulation and recovery for that pelvic floor. So when should we seek review from a physiotherapist? So if we have any symptoms of bulging, dragging or heaviness in the pelvis, that might indicate mild prolapse. If we're having any issues with control of the bladder or the bowel or even wind, if we're having any pelvic pain, so particularly with returning to intercourse, or if you've sustained a 3rd or 4th degree tear with your delivery, all of these things would warrant physiotherapy review. And remember, these symptoms, while common, are not normal. So if they're bothering you, then it is important to seek help. So in conclusion, if you have any concerns about when to get back to exercise or if you should see your physio, then talk to your GP or your care team as soon as possible to get the help that you need. Good luck with the rest of your pregnancy.
Hi, my name is Kelly Hill and this is Katrina Anderson. We are child health nurses working with community, child, youth and family health services in Rockhampton. Today we will give you an overview of our services in Central Queensland Hospital and Health Service District. Identify the resources and supports available for you as you become new parents, and discuss having realistic expectations and adjusting to the changes and challenges of being a new parent. Finally, we will give you an insight into normal infant behaviours and cues. Throughout the presentation, we have provided links to view some videos located via the Raising Children's Network. These will also be great resources once your baby is born to refer back to, so we hope you enjoy them.
This is a map of our CQHHS Community Child, Youth and Family Health Services, with building frontage images shown for our major centres in Emerald, Biloela, Warrabinda, Rockhampton, Gladstone and the Capricorn Coast. There are also services located in Mount Morgan, Thierry, Blackwater, Springshaw, the Gemfields, Boyne Tenham and Calliope.
Our services are universally accessible services for all families. We offer home visiting, telephone consults and clinic visits, as well as other services offered at certain sites, including parenting groups, early feeding and parenting support, drop-in clinics and telehealth. We have a clinical intake liaison officer and an Indigenous liaison officer who will contact you postnatally in hospital to discuss our services. Postnatal services are provided by the Midwifery Group Practice, Gamagundu, and the Extended Midwifery Service, EMS. If being followed up by EMS, they will visit you at home following discharge from the hospital. The EMS midwives will provide postnatal assessments inclusive of baby weighs, feeding, and settling advice. Once the postnatal services have completed, they will refer you to our child health services. If you live in an area without the postnatal services previously mentioned, your referral will go directly to your child health service from our clinical intake liaison officer, and they will contact you. Our child health services are tailored to meet the needs of families and will support you right through until your child is 8 years to ensure that they get a great start to life.
Please see the link to view a 2-minute video from the Raising Children's Network relating to after birth services and supports. In this video, parents and health professionals talk about support for new mothers.
As mentioned in the video, the work really starts after birth. Katrina, as you've been running the parents groups in the last few years, I thought you might like to share what the majority of parents discuss as the most challenging aspects of parenthood.
Sure, Kelly. Most parents discuss tiredness and the emotional roller coaster as the most challenging aspects of parenthood initially. Expectations on what parenthood should be may not be the same as you thought. Your baby is learning and so are you. You both have to explore and practice to get to know each other. You can expect some changes in your life when you bring home your baby. Some of the changes may be having less time for yourself, a change in your own body and identity. Some parents have had a change in their career, finances and friendships. Your relationship can change too. You may find it overwhelming to have a baby to feed and care for 24 hours a day, 7 days a week. Coping with your own and other people's expectations and stepping through the minefield of information to work out what is actually essential can also be challenging. Discussions around some of these changes may be beneficial for you and your partner to talk about and plan ahead. Just remember that there are plenty of supports available for you locally, in person and via phone.
Caring for yourself is an essential part of becoming a parent. Your own health and well-being is a priority, and attending to self-care will ensure you're available to your baby when they need you. Having realistic expectations regarding your own child and for yourself as new parents will help you adapt to the changes as smoothly as possible. Don't put too much pressure on yourself. Relax, be led by your baby's cues, and utilise the supports available, including EMS, child health nurses, health workers, your local GP, 13 Health, as well as family and friends. Your personal health record book, the Red Book, will have a list of websites and general contacts for up-to-date, evidence-based information. It has information that is relevant for your baby's health and will be used between health services as a communication tool. It also had the Child Health Information Booklet, your guide to the first 12 months inside.
Please view the 4-minute video from Raising Children's Network relating to becoming a parent. In this video, parents share their expectations and experiences of becoming a parent.
There are also many positives to becoming parents. For instance, babies have unconditional love for their caregivers. Your baby will become your own family, and the relationship you have with your baby will be unique. You can develop a secure attachment with your baby by delighting in them as they grow and develop, as well as watching over, helping, and enjoying smiling and interacting with them through face-to-face interactions. You will be your baby's protector, comforter, and you will help them to organise their feelings by being with them.
Your baby will show you how they feel and what they need through cues. These signals are to convey messages, draws your attention and provides you with information. Your baby's body language can tell you how they are feeling and what they need from you. Some cues they may demonstrate are for feeling tired, hungry, ready to play, or needing a break. Your baby can become overtired very easily, and many parents mention that they benefit from understanding the tired signs, such as staring into the distance, closed fists, jerky movements, yawning, fussing, sucking fingers, losing interest in people or toys. Sleep routines can be helpful, including bathing, wrapping, and quiet times before sleep. You can access more information on these on the Raising Children's Network website or the Alan Barham Family Centre website. Your response to your child's cues will help make them feel secure and safe. This helps to build a strong relationship with your baby. Research suggests that when you provide very young children with consistent, positive and loving care, this has a positive effect on early brain development and later life outcomes.
Please take a moment to view the 2-minute Baby Cues introduction video from the Raising Children's Network. This video shows an introduction to some of the cues that we have just discussed. This same link also shows more in-depth videos for your future reference of tired, hungry, play and break cues.
The importance of promoting cognitive, language and early learning skills in the early years, especially in the first 1,000 days in a child's life, provides the foundations or building blocks for lifelong physical, social and emotional well-being. In these earliest years, it has been shown that children develop best in nurturing and stimulating environments that enable them to explore and make sense of their world.
Through a family partnership approach, your child health nurse will answer questions and discuss and prioritise any concerns you have. They conduct developmental screening to assess if your baby is meeting their milestones for age-appropriate development. They will discuss maintaining a nutritious diet to promote healthy growth, along with supporting your feeding method for your baby. They will provide information to encourage healthy development, including recommendations for immunisations and spending time playing, talking, singing, listening, reading, watching over, encouraging and practicing what your baby is learning at their age. The parent-child relationship and parent social and emotional well-being is also discussed in these visits.
Please view this 3-minute video from the Raising Children's Network relating to what babies need for healthy growth and development and learning at 0 to 6 months.
Creating a safe, engaging environment for your baby is very important for their health and well-being. This includes a clean, hygienic environment with age-appropriate toys and feeding equipment. There can be many hazards in the home, which can lead to injuries from falls, drowning, burns and scalds, choking and suffocation, electrocution, toys, dog bites and more. Safe environments also include considering transport, water safety, sun safety, pets and medications.
Another very important area of safety is safe sleeping. Considering the SIDS and sudden unexpected death in infancy guidelines, this includes sleep your baby on their back from birth, keep your baby's head and face uncovered, keep your baby's environment smoke-free before and after birth, have a safe sleeping environment night and day, make sure the mattress is firm, clean and flat in a safe cot that meets industry standards. Make sure there is no blankets, toys, pillows or bumpers in the cot. Sleep your baby in your room. The safest place to sleep your baby for the first 12 months is in a safe cot next to your bed. And breastfeed your baby where possible.
Within our CQ HHS Child, Youth and Family Health Services, we have nurse unit managers, clinical nurse consultants, child health nurses, EICs, Indigenous health workers, liaison nurses and health workers, and administrative officers, EMS, lactation consultants, and immunisers. We work collaboratively with other professionals and services to identify any concerns, provide appropriate referrals for early intervention to promote children's health and wellbeing.
These programs are offered throughout CQHHS by Child, Youth and Family Health Services. Hospital liaison liaises between maternity and paediatric units in Rockhampton and Central Queensland. The Extended Midwifery Service, EMS, as mentioned previously, universal and targeted home visits, well baby clinics, which provide support, education and assessments for children up to 8 years of age and their parents. Drop-in clinics is a clinic to weigh your baby and have a short chat with the child health nurse.
Antenatal service is our Aboriginal and Torres Strait Islander child and family health service. Hearing clinics for children from 4 years of age, school hearing, school readiness, school-based youth health service.
We also offer groups including the early parent groups for babies under 3 months of age, which runs for 2 hours per week for 4 weeks, covering topics such as sleep, settling, infant feeding, growth and development, and postnatal mental health and wellbeing. These sessions are well attended as it helps parents recognise what's normal in infants of this age and provide social interaction with other new parents. There are also further parenting education sessions on additional topics as required. The early intervention clinicians offer support and work with parents promoting attachment and parent-child relationships. The ability to understand and respond to challenging child behaviour and adjustment to parenthood, and will support parents with postnatal depression.
We hope that you have enjoyed learning about what child, youth and family health services can offer you following the birth of your baby. Please contact us if you wish to engage with our service at any time. We hope you find the resources we have provided in this video useful and look forward to meeting you following your baby's birth. Thank you.